Hi, I'm Dr. Jim McDonald, Medical Director of the Rhode Island Department of Health.
I'm Dr. Phil Chan. Welcome, everyone.
So thanks for joining us today, and thank you for the work you're doing to help others learn more about monoclonal antibodies. And today we're going to talk about monoclonal antibodies and approved treatment for COVID-19. And monoclonal antibodies are often called MABS. So MABS is not part of our daily lexicon. It's a new word for us, but MABS is just an abbreviation for monoclonal antibodies. But Dr. Chan, what are MABS? What are these things?
So the way that I like to describe this is really to borrow one of your statements that I've really loved, instant immunity. So MABS are essentially preformed antibodies. Antibodies are those substances in your body that attack viruses or bacteria, anything that's infectious or going to harm you. So essentially these MABS are preformed antibodies against COVID. They're infused inside of you, and they're there to fight COVID, and they start fighting it right away, an instant immune system.
Yeah, and they're made by a pharmaceutical company. Like right now, Lilly and Regeneron are the two companies that have made MABS. They're pharmaceutical products, and they're given to people in their veins. But when you really think about how MABS work, I like the way I've described it as an instant immune system. But what does the instant immune system really do? What do monoclonal antibodies do? How do they kill the SARS-CoV-2 virus? What do they do?
So for people that get really sick, what happens is this virus starts to disseminate and affect your entire body. And so when you have these MABs present, when you've been administered these MABs, infused with these MABs, these antibodies start to bind to the virus and inactivate it, and they target them for destruction. So the thinking behind and what happens inside your body is that these monoclonal antibodies essentially target and destroy the virus, and they're incredibly effective. I think one important point, though, is that we've learned through the science and who benefits most is really people before they get really sick. Really, the earliest in the course of your infection is when these MABs are most effective. So they're not meant for people that are in the hospital. They've done some of those studies and shown that there's no benefit there. It's really for people that have mild to moderate infection disease before they progress and end up in the hospital.
Yeah, you definitely want to get it before day 10 of your diagnosis. But it reminds me that MABs are fast. In other words, you literally go in, get an intravenous infusion. It takes anywhere from 15 minutes to an hour, and you really might feel back to normal within a day or two. It really does help that much, and it does help prevent people from getting sick and ending up in the hospital. That's one of the things the science is pretty clear about, and that's the real power of them. They really are the first emergency use authorization approved treatment for COVID-19. But Dr. Chan, who really can take MABs? Who's the target audience for these?
Yeah, so MABs are really meant for people who are at risk of ending up in the hospital. So people at risk of severe disease, consequences. And what we've learned through the data and the science and unfortunately, that people who are a little bit older tend to have worse consequences. And so MABs are really indicated for people 65 years of age and older, or people of any age that have underlying health conditions. And that may be people that are immunocompromised, maybe younger than 65 or older than 65, any age, who have cancer or on otherwise immunosuppressed or immunocompromised, people who are just at risk of being sick. We've also learned that people who are obese or people who have high blood pressure, some very common American medical health conditions do put people at increased risk of severe consequences due to COVID. So folks with those should also be considered for MABs. At the end of the day, if you have any questions, check in with your provider, your primary care provider, other clinics about how to get MABs, which I think brings us to the question of how does a person get MABs if they want to know about it?
Yeah, so the easiest thing to do is talk to your doctor who can set up a referral for you to get MABs. If you don't have a doctor, there's some places that we've identified in the state that will actually just see you on the spur of the moment. So one is a relationship we have with Brown Emergency Medicine. They have telecare by Brown. So the Brown Emergency Medicine physicians who staff a lot of the hospitals in the state have an own telecare option. And you can just have a real-time video visit with one of their doctors, and then they can refer you for monoclonal antibody treatment or MABS. There's some urgent cares in the state too, though, like Blackstone Valley Community Health Center, Ocean City Urgent Care, South County Express Care, Thunder Miss Health Center. These are folks that have said we'll see people either in person or more preferred a video visit, a telehealth visit where they can actually decide if you need monoclonal antibodies, if it's right for you. And it really gets me to think about the earlier you get it, the better. So you really want to get it within 10 days of your diagnosis. And what do people expect, though, when they get a monoclonal antibody infusion? What would they expect at one of the infusion centers where we have people going to?
Yeah, so in general, people will have done very well. So I think one of the key things about this that makes it different from many other medications is you do need to get it through an IV line. And that's different. That means that you can't just go to their pharmacy and get this prescription filled. You have to actually go to a site. So when you go to one of these sites, they're set up essentially with IV infusion poles and little bags that they'll hang, and they'll start an IV and administer the medication. It takes about an hour, and you have to wait around for an hour afterwards to make sure that you don't have a reaction. But people have done well, and I think to your point, day or two, people generally start to feel great. It's really demonstrated good efficacy, and people do well after.
One of the things people often ask about too is, will my insurance cover this? So, insurance is a complicated beast, but let's talk about insurance a little bit. So the medicine itself, the monoclonal antibody itself, is already paid for by the federal government. So that shouldn't be a barrier. There will be a charge though from wherever you get it for the infusion. A lot of times that's going to be covered by your health insurance. And there might be a charge, of course, when you see a doctor, but that also should be covered by your health insurance. Now, if you don't have health insurance, which not everybody does, then a lot of places will work with you and give you a reduced fee and find a way to make sure there's something you can do. Right now, I really wouldn't let cost become a barrier to acquiring treatment. Think about it. If you get sick with coronavirus disease or COVID-19, could be life-threatening, could end up in the hospital. It's far better to get the treatment and take care of that than end up in the hospital. That's not good for anybody. But what I'm next curious about is vaccination after treatment. If someone gets monoclonal antibody treatment, how does that affect their ability to get a vaccine? Let's talk about that, Dr. Chan.
So it is recommended, and based on the science that we have to date, which is evolving, we do know that if you get the monoclonal antibodies, you should hold off on getting the vaccine for at least 90 days. We are still encouraging people that have had COVID to be vaccinated. And in fact, what we've learned is if you are infected and you get the vaccine, is that we can see immune responses are much higher in those people, which means that they're protected again from other infections. But if you get the monoclonal antibodies, it is recommended to wait 90 days. And the reason for that is because you're essentially being infused with antibodies, which is what your body's trying to create after vaccination. So those antibodies by the infusion need to wash out, need to disappear over time in order for your body to develop antibodies to the vaccine. However, I think, and we've discussed this a little bit, I want to just encourage people to get the MABS, even if they want to get the vaccine in the future. I think one thing that we've seen some people be hesitant about getting MABS because they want to get the vaccine, even though they currently actively have COVID. And I think one thing to remember is that COVID obviously has killed many people here in Rhode Island, across the United States, across the world. So people really need to consider MABS if they're at risk of severe disease. So people that are a little bit older, 65 years of age and older, and have underlying health conditions with mild to moderate disease, you really want to consider MABS, even if you're planning on getting vaccinated in the future. Yeah,
I think it's really important to think about it this way. MABS is treatment for COVID-19. The vaccine prevents COVID-19. But if you're already infected with COVID-19, it's too late for prevention. It's time for treatment. Think about it this way. Most of us are considered with people getting pneumonia. We're familiar with pneumonia being a disease, right? So if you have pneumonia and you go to your doctor says, well, I want to give you an antibiotic, you wouldn't say to your doctor, oh, I don't want an antibiotic. Let me see if I survive this first. Then I'll get a vaccine in a few months to prevent this. Well, that just doesn't make any sense. What you would do is say, thank you, doctor. Of course I want the antibiotic. I don't want my pneumonia to cause me any harm. I don't want to end up in the hospital. And the point I'm trying to make here is monoclonal antibody, or MABS, is a treatment for a disease. It doesn't make sense to hold off treatment to look for prevention. You can't prevent what you have because now you already have it. So let's get back to another topic here is, how do people protect themselves against COVID, Dr. Chan? Like when I think about this in particular is, what should people do to protect themselves against COVID? What are your thoughts on this?
It's a great question. I know that everyone's getting a little bit tired of the pandemic. We're over a year into it at the moment, but I think just adhering to what we've been preaching really since the beginning, which is make sure to wear your mask, especially when you're in public. You want to physically distance. You want to avoid large social gatherings. You want to make sure to wash your hands. You want to make sure, if you can, when you do gather or when you do socialize, to do so in an outside space, because we've learned that ventilation is also key. Anything else I'm missing there, Dr. McDonald?
Dr. Chan, just making you talk about it, maybe get my high quality mask and put it on. I got my hand sanitizer ready. I'm ready. And I'm just going to make sure I don't get COVID as I try to get through the rest of this pandemic here. And I think the last thought about how to make sure you protect yourself against COVID is, when it's time for you to get a vaccine, go ahead and get that vaccine. I don't have any other thoughts though. Dr. Chan, any final words for today?
Just want to thank everyone for your work. Thank you for all your work on the front lines, for making this happen. Keep it up and let us know if we can do anything here at the Department of Health. Thank you all.
Thank you. I'm Dr. Jim McDonald, Medical Director, Rhode Island Department of Health.